Hi, and welcome to this installment of Frank and Mary here on Nantucket. If you haven't seen the show before, my name is Art Bergeron. My day job is as an elder law attorney at Myrick O'Connell, but this is not about my day job. It's about my friends Frank and Mary. If you've seen my presentations at the Salt Marsh or on cable, you know that Frank and Mary's goal in life is to live in their house until they die and be buried in the backyard. So if that's like you, then we want to help you know who the people are you need to know and what the programs are that you need to know about in order to do exactly that, to stay right here on Nantucket. So with me is my wonderful co-host, Alison Forsgren, who we've been doing this like just for a long time now, for like years, but she continues to get us these great guests to talk about just these issues. And I think our guest this month is this is a really important topic, and it's a wonderful guest. So Alison, whom do we have?
Well, first I'll give a little background. I was very fortunate to book this guest relatively just a few days ago after meeting her at my neighborhood outdoor holiday bonfire. Little did I know that I was living several doors up from Kelsea Gray, who is our guest today. She is the nurse manager for Nantucket for the Visiting Nurses of Cape Cod, which covers Cape Cod and the islands. So she is also the primary hospice nurse, and who knew? She lived right down the street. So Kelsea, thank you so much for being my neighbor and joining the show. We'd love to hear what you do and how you do it.
Thanks for having me.
Yeah.
Kelsea, thanks a million. And as we had mentioned earlier, the one question I get to ask in these shows is, so how did you get here exactly? Because, Nantucket is filled with, people who are from there and some who are not. So how did you end up on Nantucket?
So I grew up on Nantucket.
I
went to the new school the whole way through, and then to the high school for a couple years, went to boarding school, came back, went to college, came back. Finally, as an adult, we said, we're done with Nantucket. We moved off island and lasted a whole 6 months. Came back, and we found this gift of a house that was a foreclosure in an online auction. And we won it in 2019, March of 2019, I think. And, we're so grateful to be in this great little neighborhood on Nantucket, and we get to call it our home forever.
That's great. That's great. So thank you for that. So now I'm just going to reiterate, as Alison was saying. So, kind of what are you doing, and how can people connect with you? How can people be helpful? Just in general.
Right. So I'm the clinical nurse manager for the Nantucket team of the Visiting Nurses of Cape Cod. And with that, we cover both home health and hospice. So I am the primary hospice nurse. And then under me, we have a good group of physical therapists, occupational therapists, some nurses, health aide. And, we are a insurance-driven company. So we do work with insurance policies. We're never a long-term solution per se, where some of the other private agencies, you're looking at your 24-hour care. We're more the acute in terms of home health. We're the acute, like you just discharged from the hospital having a pneumonia episode, or you just discharged from the hospital having a knee replacement. And we come in and help you as an elder learn how to be independent in your own care. And when you are independent again in your own care, then we discharge. Then we have the opposite route of things with hospice, where we can stay in longer term and give more benefits and a little bit more assistance, because we're talking about closer to end of life.
Wow. So people are referred to you by their healthcare provider, or how do you actually sign up to be a client of the Visiting Nurses?
Yeah. So most of our patients we're getting directly under home health. We are getting most of our patients directly discharging from Nantucket Hospital, Mass General, wherever they've been, whether that be that, like I said, you had a complex pneumonia that required admission, you have a CHF exacerbation, you have a knee or hip replacement. We get a lot of those directly post-discharge, we go in, typically our goal is within 48 hours of discharge, and we can bring in whatever you need: nursing, physical therapy, occupational therapy, your health aid. And with that, our goal is to be there to support you until you're able to, again, do that yourself. So we work under your insurance to provide you the care that you need so that you can be home, rather than potentially having to go to a rehab or something like that. That would be an inpatient. And of course, I think most people's goal would be to be home.
Right.
So then additionally, we do get some referrals directly from like Dr. Pearl, Dr. Lepre, whatever. If you have a wound, or if you have just an episode that didn't necessarily require an ER trip, but they need someone to just go in and check on you, we can do like a safety evaluation also, to make sure everything is smooth going in the house. And we go in just time for like a one-time safety eval, depending on what the doctor orders.
And
So
go ahead.
So the Council on Aging just received a grant to help install things that help people stay at home longer, grab bars, little ramps to get over door things.
Right.
And
That's awesome.
Yeah, and
we were just talking about this. Yeah.
How we could find people who required or needed those services, and what exactly would those services entail. Do you, for instance, work with elder services?
So we work with elder services. I'm talking to Sherry Hunt regularly, and working on those pieces. And when we start to talk about like discharge, we need to know that there is a safe discharge plan from us. So with that, we're typically bringing in people, whether it's from elder services, whether it's from tucked in or private care. And then those people are going to step in essentially for us for that long term. We work a lot with the Masons group, who have all the equipment and they help with the donations and things. But, we were just talking about this in the office yesterday, knowing that there was this grant, trying to figure out if there was maybe a better way that we could expand the role of people who do the equipment delivery, and do the setup. We're so lucky that Buzz will come over on a Saturday afternoon and throw in a ramp for somebody, but that's not always a same day thing, because he has a real job too. So maybe if we could make that a bigger group of people that were doing those deliveries and pickups, with that grant, it'd be a good opportunity for the community.
Mm-hmm.
I see, because on Nantucket, the Masons kind of have a lot of this kind of equipment, which they kind of loan to people while they're not well.
Absolutely. And they do it, completely for free, and they lend it out, and families, we always recommend that they donate to them, especially after our hospice patients pass. They take a lot of the equipment the way the elder services used to. Now, my understanding is the elder services is not stocking and lending the equipment the same way they used to, because of their like limited staff and all of that. And the Masons kind of took it over.
And when you were talking about the work that you do, and then you refer to discharge, it's funny, because for the average person, you think of being discharged from a hospital. You don't think of being discharged from like the VNA. So and I was unaware of that. So there's actually, you folks actually do like discharge planning as part of the work that you're doing at home, because you're just basically saying, here's this person who has met the goals that we had set for her in terms of her getting better, and now she's kind of like plateaued, but maybe she's plateaued at a place where she really can't be safely at home anymore, right? And so now what? And so that's what that discharge plan is. It's just connecting with these other players.
Absolutely. Yeah. And it's pulling in family, it's pulling in friends, it's pulling in like what people are eligible for under elder services, potentially mass health, any of that kind of thing, trying to bring in the long-term solution so that you can stay home safely. We never are going to jump out of a case that is seeming unsafe. When we're talking about, the knees and the hips replacements, those are pretty straightforward. You have your patient who's homebound, whether Medicare or, just your average commercial insurance, right? and they're homebound because they're post-op and they do their physical therapy, and then they graduate onto outpatient physical therapy. So then we discharge because they're able to get in and out of the home safely. Now, it is a little bit more complicated with people who, like we were talking about, have the new pneumonia. Maybe they went home on oxygen. Now, our goal might be that they don't have to be on oxygen forever, but they're going to be on oxygen for a month. So we're going to be there and make sure they know how to manage it. A family member or a caregiver knows how to manage it. And then once that's all set and maybe they graduate off of it because they're doing better, then we can safely discharge. So
And
we
so
have
that-
to be following like a skill. There has to be a skill in the home that we are teaching someone. Medicare has really made a lot of changes that where we used to go in and provide care, our goal is to go in and teach you how to care for yourself.
Wow, I think that's a good way to look at it. I mean, and also sharing information with caregivers so that they can be doing the right thing instead of what they always thought was right. Now I have a question. I'm a volunteer for PASCON, and back when they were Hospice Foundation of Nantucket, there was a little bit different connotation. So they decided to change to Palliative and Supportive Care on Nantucket, PASCON, which is a free service. It's a wonderful service. We have a new director, volunteers that are trained to actually go into homes and assist, not post-COVID. COVID has really stuck a pin in our balloon when it comes to what we can do to help clients. But there is a difference between hospice and palliative care, especially when it comes from PASCON. Do you know anything about that? Or I know that, so how do hospice patients find their way into your service?
So PASCON is working with, really anyone who needs palliation of any symptom, whether that's chronic illness. So someone who has COPD, the chronic obstructive pulmonary disease, someone with, chronic heart failure, any of those kind of things that need symptom management can be covered under that palliative care branch. Anyone who has chronic pain issues, anyone who's an oncology patient, right? They can be managed and helped with through PASCON. And they're going to help with the symptom management as well as the caregiver support group. And I think that PASCON has some great caregiver support groups and like psychosocial counseling available to their patients and the patients' caregivers and family members. Now, with that, there does not have to be any form of prognosis. You can work with PASCON for 5 years, 10 years, whatever your lifespan is, right? But when we're talking about a hospice route, typically PASCON says, we don't get all of our patients from PASCON, but some of the ones that PASCON's in, they will step back from as we go in because it ends up being just too many cooks in the kitchen, if you want to call it that. Just too many hands in meddling with medications and just differing opinions on how to do things, and it gets confusing for family. So our hospice is primarily Medicare. And Medicare benefit of hospice, you're unlocking some assistance in the home. So we bring in our health aide, your nursing visits in the home. Your primary difference is that when you choose to go hospice, when you are given a prognosis of you are more likely than not to pass within the next 6 months, which is the typical prognosis for hospice. You also have to be okay with saying that, like, I want to stay home. If I fall, I'm not just going to rush to the ER for an X-ray. If I have something going on, I'm going to call my hospice nurse who might come see me tomorrow rather than I'm going to rush to the emergency room. So you're essentially choosing to stay home and be home. And those are some of the different things. Of course, there are some instances where you have to go to the emergency room as a hospice patient, but our goal is to be home. And so a lot of for example, our oncology patients, I mean, they're just going to keep dying trying, which I think is so phenomenal, right? But a lot of them don't elect hospice because that would require that they stop their chemo. until it's more clear later down the road. But your hospice benefit is typically meant for the last 6 months of your life. And with that, we do have people who are on hospice a lot less, and we do have people who are on hospice a lot more.
I have to say, I've never heard the noun palliation. What a great noun. No, that really is. It really is, because you always hear about palliative care, but so what is it? It's palliation. So would you say that broadly palliation is just kind of, focused on, when I hear that term, I think of it as just being focused on kind of reducing pain and on
Right.
What I always hear the distinction is quality versus quantity, that you have someone who is now not totally focused on prolonging the number of days of life, but rather trying to focus more on how good is today and how good is tomorrow going to be, and how good.
Now, I think that what you're describing actually is a little bit more of the difference of palliative care versus hospice. Now, palliative care, yeah, the palliative care, I mean, you could have any chronic illness for many, many, many years, and you want to enjoy those many, many, many years, but you don't want to be short of breath walking from the couch to the fridge, right? So palliative care, PASCON, is working on how can we relieve those symptoms so that you can enjoy every day for as long as you can, right? Now, hospice, of course, we're doing the same thing, but it's not maybe thinking about how can we keep things going for the next 5 years. It's how can we keep you comfortable today? The line I always give families is, we help maintain the highest possible quality of life for as long as you can. And then when you can't, we're just supporting the patient to be comfortable at home, right? So we're never going in, everyone has this idea of the word hospice, right? We're going in and we're killing people. We're going in and they're just going to die tomorrow. No, we want you to be as high functioning as you can be for as long as you can. And at some point that won't be the case, but you have someone to call 24 hours a day when it's not.
And I guess I kind of try to emphasize to folks, a lot of people graduate from hospice. When I first heard that term, I said, you mean they die? No, you graduate like you get off of hospice, because, I was really struck this one case. I had a woman who had gone, I remember talking to her niece, who was kind of her caregiver. Then she went to the nursing home and said, oh yeah, she's on hospice. I said, well, that won't last long. And I talked to her like 2 years later, and it was like, oh no, she's, I said, so what happened? Oh, she's fine, and it turned out that the hospice, as a result of doing hospice, she got off a lot of the drugs that she was on, right, when she was doing all this other stuff, and she got better. I mean, she didn't get like great, she still had some cognitive problems and stuff, but it was a wonderful thing. It was just a wonderful thing.
Yeah, right. I mean, and so I think people are often afraid or being referred to hospice is too frightening because they don't understand what the whole plan is when you do join up with hospice. So do you have or need anything from your, like, what about volunteers? Does the VNA have volunteers that help out with things, or?
We do have some deficits right now. We are looking for another health aide or two. We are looking for an occupational therapist, and we are looking for volunteers. Volunteers is a huge part of hospice care that we, as long as I've been with the VNA, have never been able to provide because we do not have volunteers. Now, I understand it is a little annoying because we're owned by Cape Cod Healthcare, you do have to go off island to get cleared by occupational health. It's a less than 10-minute walk from the steamship boat, and they pay your ferry if you're going to be volunteering. But it's a commitment, and I have tried to advocate that, if we could get them cleared here, I think we would maybe have more volunteers. But I also think that part of it is the misunderstanding a little bit in the community of PASCON versus hospice.
Exactly.
And I love that PASCON has volunteers. I just wish we could share them.
Yeah, hopefully we can at some point in time, or else alert people to the fact that the VNA provides the hospice service, because it was used to be just, oh, Charlene does it. Well, things have changed a lot since Charlene retired. There's a new director of PASCON, Deb, she's wonderful. Some new office people. Angela is in the office now. Great staff, but it would be great to combine forces or outreach for additional hospice volunteers, because people would like to take the class. People are interested in helping. I think COVID, once we shake off this, the COVID restrictions, because they have really had, made a problem in the volunteering.
Right. So
community.
our volunteers, Cape Side, they're back in. They're in the home. A DPH requirement is that our volunteers are vaccinated. But they are back in the home. On the Cape Side, they're doing, they have music therapists who will go play the violin for you. They have chaplains. They have Reiki. They have the pet therapy, they have the companionship support, the grocery shoppers, they have all of those volunteers. And even if you're someone who isn't comfortable going into someone else's home, we would take you as a volunteer if you just want to go run to the grocery store to get 20 things and drop it at someone's doorstep. So those are there's many avenues to volunteering that we can work with if we were to have them, and we would be so lucky to have them.
And if somebody, I guess I had two questions. If somebody wanted to volunteer, are you the person they call? Is that, and I get,
it'd be a good place to start.
And so we'll get you, if you can get us get the contact information to NCTV. They're great about these folks. Katie O'Connor is doing the show right now, but these folks are great about, adding that, doing a banner so that people will have your information so they can contact you. But can you talk a little? Can you speak a little bit to this problem on the Cape? Because I'm trying to think as to how this problem could be solved. What is the problem? What is the clearance that has to happen on the Cape for people who are volunteers on?
Sorry. So the occupational health is run by Cape Cod Healthcare, and I have tried to advocate for it, but it's like I'm not positive if it's the same for volunteers, so I don't want to misspeak per se. But with our staff, for example, they have to go off and they have to clear that they've been vaccinated for like the chicken pox and COVID and the flu shot yearly, so that they know that we're safely going into people's homes. And those are things that we don't have a contract with Nantucket, and I'm not quite sure that we will get one with Nantucket Hospital, but it's something that I have advocated for. So maybe we can close that gap, but it's really like a 45-minute appointment, and it's 10 minutes from the boat walking. It's not a huge thing, but it is a thing.
Right. But for folks who are here, especially for seniors who may be volunteering, it's it's close to the boat, but it's a boat trip away, and so
exactly.
to be able to try to figure this out would be really handy.
Absolutely.
That's really interesting.
And so is there anything else that you would like to share with our listeners about your program, or what you would like it to become, or people have a long history with because it wasn't always the VNA of Cape Cod. It was several other things before that, and some things ran smoothly and many things didn't. So
right.
I think we're off to a good run right now. And how do you feel about that?
I mean, we are so lucky for the team we have. We have Alison McKay working with us. We have Stephanie Ray, two longtime Nantucket people. We have great physical therapists, Elizabeth Camp and Julia Heiss. Jenna Darkow is our occupational therapist. Tracy Boucher is our health aide. We have a great group of Nantucket people. And, all we can hope is that we can keep expanding with that. And I hope we can. We are definitely low in our census right now. We don't have a lot of patients. If anyone is ever admitted to the hospital and they feel they would benefit from VNA in the home, you're absolutely able to ask the doctor at discharge for a referral, even if we come in and just say, oh, well, it seems like you're doing fine, and we don't admit you. At least you had someone checking on you, if that's what you would feel safer with. So you're allowed to ask for that. It is insurance covered, which is great by most insurances. I don't know. We're just such a good team, and I wish that there was a way that we could provide more to more people. But our census is what it is right now, and it's pretty low. So whatever we can do to boost it up, I think just knowing that we're here, you know, and knowing that it's an option to you will help.
You know, I find that Nantucket provides so many great services, but there's no one hub of, if you need services, where do you go to look for it? So we try with this show to advertise or advocate for the groups that do such great things for people. And, you know, because many of us have long memories. I mean, you know, I can remember Brenda Johnson running the, you know, the cottage care or whatever. And,
Right.
you know, and that kept going for quite some time and was really consistent. And I think it's when things break and are rebuilt, that somehow doesn't get into everybody's mind. So I'm so glad that you're my neighbor, and I can advocate for your services. And I hope that people who are listening, you know, can do the same. But I'm very excited that you're around, and I hope that you grow your team. And if there's anything that I can certainly do to help, let me know.
Maybe we can do something at the Salt Marsh, you know, if things are kind of opening up. Maybe in 2022, we can try to do something with some PASCON folks and with Kelsey and people from her team, just to be kind of talking through this issue. I think that it could be really worthwhile, because I think what unites all of these folks is just this kind of real dedication to, you know, taking care of people, to really taking care of people, and taking care of people sometimes during some really difficult times. And so, and to just make people aware of that, I think would be really, really useful. So Kelsey, thank you so much for this. This was really great.
Thanks for having me.
Thank you. And Alison, yet again, you know, thank you for just getting these wonderful folks who I think are just providing great information, right? So folks, Kelsey, I know you're gonna have the contact information, but could you say, is there like a phone number for us old people who still use phones? You know, is there like a phone number that people could? She laughs. Yeah. She laughs like, oh yeah, those old people, right? Is there a number that they could call, right? And then your other contact information will be on the screen, right?
Right. So the main number to VNA is 508-957-7400. And from there, you can just ask to be directed to the Nantucket team, and it will just come to me. And that's probably the easiest one.
Kelsey, thank you so much for this. Alison, once, as I was saying earlier, you know, you've got some great people this year. We're talking, folks, we're actually talking about going live. We were talking earlier about actually being at the studio so we can show off the studio, which is also really special. You know, you're gonna love it. It's like, so we'll look forward to seeing you next year. Hanukkah's already passed, but Merry Christmas.
Happy holidays, yes.
Happy holidays, and we'll see you all. And Alison, we'll see you in 2022. Thank you so much.
Excellent. All right, goodbye. Thanks so much,
you.
Kelsey.